Well, welcome to the 2024 Medicare update. It's hard to believe that summer has passed and fall is upon us and our annual enrollment period. So here we are, Ford Insurance Agency. I'm Dawn McConnell.
And I'm Laverna Dawn.
And as always, we are here to educate and to help out in any way that we can with your Medicare plans. So today's agenda, we're gonna go through some frequently asked questions to start with. And we want to do that just because there's questions that you all have, and it's the ones that we hear all of the time. So we're gonna hit that at the beginning. And then we're gonna take a shallow dive into some of the Blue Cross Blue Shield of Michigan plans, as well as the Blue Care Network plans. Then we're going to take a very deep dive into the Priority Health Medicare Advantage plans. And we're taking a deep dive into that because that's the plan that pretty much the majority of our clients are on.
And we highly recommend.
Yeah, and we'll get into that for sure of why the majority of you are on the Priority Health plans. And then we're going to end the same way we began with the frequently asked questions. Because sometimes as we get into the material, all of a sudden that same question will pop up into your head. So we're going to repeat it at the end. So just to start off, we're going to get right into those frequently asked questions. Laverna, I'm going to toss this one to you. The question is, do I have to do anything to continue with my plan if I'm happy with it?
All plans automatically renew. So if you like your plan, you can keep your plan and it automatically renews. You do not need to do anything.
Not a thing.
Not a thing. I like that.
I like that too. The next question that we get a lot is, if I'm on a plan that has a premium, should I change to a $0 plan?
The answer to that, I would say, is maybe. If you are...
It's a solid answer.
Well,
maybe.
Yeah, that's a good solid answer for sure. Maybe because as we get into this, there's going to be some advantage plans that you might be paying a premium for, and we're going to make recommendations that you need to get out of those plans, or at least talk to us about getting out of those plans. The other thing is that you might be on a Medigap plan and have a separate prescription drug plan. Excuse me. You might be on a Medigap plan and a separate prescription drug plan. If you're paying premiums for those, you will most likely want to at least address the idea of looking at an advantage plan, because sometimes we find those plans to be not cost effective anymore compared to the advantage plans.
And I think too, to go on to that point, a lot of people several years ago were told to never go on advantage plans. The advantage plans have changed enough over the last several years that I think it's really definitely worth a conversation to at least look into those now.
Yep, so that's our good, solid maybe answer.
Next question, Laverna. How do I add dental or vision to my plan?
There's a few ways that we can do this. One, we could send you a link and you can go onto that link and change it yourself. I've had several clients just call into Priority Health, the customer service number on the back of their card, and change their plan that way. Or we can send you a form to fill out and send in. Whatever works will help you make sure that you can change your plan.
Perfect. I'll take this next question. The next question that we hear a lot is, do I need to show my red, white, and blue Medicare card when I go to the doctor? And the answer is, if you are on a Medicare Advantage plan, no, you do not. You can take your original red, white, and blue Medicare card and put it in a safe place. You are not going to need to show that to the doctor anymore. However, if you are still on a Medigap plan, a Plan G, a Plan F, a Plan N, if you're on those plans, then yes, you do. You need to give your Medicare original Medicare card as well as your Medigap insurance card when you go to the doctor. But for most of you, you're on the Advantage plans, and you will not need to show your original red, white, and blue Medicare card to the doctor. And last question, I'll toss this to you, Laverna. Do I get a dental and vision card?
That's the beauty of these Advantage plans, is everything is in one card. I even brought a visual for us today. This is my husband's card, and we'll be referring to this. So as we go through these slides, if you have one of these Priority Health Medicare cards, we're going to encourage you to pull that out. Okay?
Yeah, if you would pull that out actually now and take a look at it on the card itself, right kind of in the middle, it tells you what plan you're on. that's going to be important as we go through the slides here. So, all right. So we, as I mentioned earlier, we are an independent agency. Ford Insurance Agency is an independent insurance agency. We like that because that means we are not captive to just one particular insurance company.
Right.
We can work with we can become agents with whatever insurance company we feel like is a good company to work with. So we have primarily just chosen to work with Blue Cross Blue Shield of Michigan, Blue Care Network, and Priority Health. The reason we choose to only work with those companies is they have the best network in Michigan. So we can look at all the other different companies that you're seeing on TV. There's a lot of them. And if we lined up the benefits would be super competitive with each other. Yeah. But we don't want to provide you with a Humana or a United Healthcare, or all the ones that are out there if they don't work well in our area. And so we've found that Blue Cross Blue Shield, Blue Care Network, and Priority Health have the best, most robust network here in Michigan. So we work with the Medicare Advantage plans at Ford. We work with Medicare supplements, Medigaps. And for those of you who are maybe pre-retirement, thinking about retirement, you have friends, family, children who are under 65 and are looking for health insurance plans. We offer plans through the marketplace and straight through the carriers for individual medical plans.
Yep.
So, all right. So here we take our shallow dive into the Blue Cross Blue Shield of Michigan plans. I'm not going to spend a lot of time. There's a lot of information on this slide here. I'm not going to take a lot of time of diving into it, but I do want to at least acknowledge that we do offer these plans as well. Very similar to the priority plans, the Blue Cross has $0 premium plans. They have plans that have premiums. The core benefits are going to be comparable to some of our priority plans. The Blue Essential plan has been around for a long time. That's one of Blue Cross's $0 premium plans. As well as the Blue Part B credit plan. There's some qualifications there. And they have a new retail plan that will be coming out here in 2024 that will also have a $0 premium plan. If we look at the Blue Care Network plans, here we have some $0 premium plans as well. Blue Care Network has their Prime Value plan, which is a $0 plan, as well as their Elements plan. Keep in mind, though, that the Elements plan is a medical plan only, does not provide prescription coverage. And you'll also see on the map there that the network is a bit limited with the Blue Care Network. So we're always a little bit cautious when we're looking at the Blue Care Network plans. Okay, and so with the Blue Cross Blue Shield and the Blue Care Network plans, they also offer a buy-up for their supplemental dental and vision. All the plans include baseline dental and vision in their plans, but they offer a buy-up that gives you just bigger, more robust dental and vision plan. For their PPOs, they're charging $20.50 for that buy-up. For the Blue Care Network, you're saving 20 cents here, and it's a $20.30 buy-up. Now, I like to just put this disclaimer out there. The Blues use Blue Dental. And one of the issues that we are seeing here in Northern Michigan is that a lot of dentists have decided to not participate with Blue Dental anymore. So that is one of the reasons that we lean a little bit more towards green. And I'm going to shoot this over to Laverna here to just kind of talk about why we prefer to work with Priority Health.
Right. And I think it's important what John just explained, that the Blue Cross plans and everything, and yes, we do offer those as well. However, we do our research on this every year, and we just go back and forth between the plans and watch what's going on, and we're still convinced that green is the better option for everybody. So with that in mind, I want to go to the next slide and talk about the priority Medicare leads market, how they lead the market again. So this slide goes through all of the, I think it's 13 companies now, I'd have to count, but anyway, I'm pretty sure there's about 13 companies in Michigan now that offer Advantage plans. And as you can see there, Priority Health leads the pack. They're in the left side with the solid green line there. And of course, the Blue Cross PPOs and HMO programs are the second in line. So we feel very confident about who we offer in terms of the companies. But again, this definitely shows you that Priority Health still leads the pack. Okay? Here's a few things that we'll go over, some testimonials about Priority Health plans. Well, first of all, they're a local Michigan-based plan. A lot of times people like to deal with local companies like that versus a company out of state. There's, you're going to see that 9 out of 10 of the physicians in Priority Health or in the state of Michigan participate with Priority Health. There are a handful of physicians, primarily in the southeast Michigan part, that they don't, for whatever reason, there's a handful of doctors that do not participate with Priority Health as a company. So just want to be...
But every major medical center does participate, which is huge.
Yep, that is huge. They have every major medical center in Michigan participate. There's the 5-star rating that they've had this year with their key plan and their other HMO point of service plans. That's been awesome. 5 stars is the best you can get rated with the government on Medicare Advantage plans. They've been doing this for 30 plus years. I feel like I'm old enough to be around where I've been dealing with them all of those 30 years. So anyway, I remember when they moved into northern Michigan, believe it or not. So yeah,
are you?
Quit it. Anyway, but I've been around a long time and worked with Priority Health as a company, and I can testify that they're very good to work with. We've already shown you how they're the #1 choice in the Medicare Advantage world in Michigan. So this gives us many reasons why we think that it's good for you to look at Priority Health plans. Here's a few little testimonials that we found that you can kind of glance over. They're, customer service wise, product wise, how they serve their clients. I've experienced it all over the years, I feel like sometimes, and I can't say enough good about how Priority Health treats my clients, offers their plans, and overall does their customer service, as well as how they serve us agents as well.
Right. All right, so we are going to dive into some of the plans specifically. We're going to dive into first to the HMO POS plans. I do like to reference that POS stands for point of service in case you were thinking it stood for anything other than that. So if you take a look at this next slide, it's the state of Michigan, and it talks about the regions of the counties that are out there. This is going to be important as we continue through our conversation here today to know what region you are in. So here in the Grand Traverse area, we are in Region 3. So a lot of times we'll be referring to the benefits that are here in Region 3. But if you live outside of the Grand Traverse area, make note of what region you are in, and that will be helpful as we continue this conversation. So the first plan that we want to talk about is the Priority Health Medicare 1 plan. Now, this is only available in Kent, Ottawa, Oakland, Macomb, and Wayne County. So I'm not going to spend a ton of time on this slide as it really only applies to a few of you who are in those counties. But we wanted to at least explain to you that if you're on this plan, if you want to know more about it, or if you live in one of those counties and you want to know more about it, let us know. Give us a call.
I think I actually have about 3 people on this plan.
Well, look at that.
Maybe 4. Yeah,
okay, so great. Yeah, it's a great plan. It has a lot of great benefits there, and not too many plan changes, as you'll see on the next slide here. Not too many changes. You'll see that all the changes for the better this year are in green. So you'll see that cardiac rehab went down by $5, the over-the-counter benefit increased, and across the board on all of the plans, in the black is the negative changes, and across the board, ER went from $110 to $120. That's consistent on all of the plans. Okay, the next plan that we're going to talk about is the Key Plan. We love this plan.
It's my favorite
This
one.
is my favorite plan as well. It's the plan that received a 5-star rating this year, and it continues to be the front runner for 2024 as well. New for 2024, you're going to see an increase in that over-the-counter benefit. Here in Region 3, this year, we are at $55 a quarter.
Mm-hmm.
It is bumping up to $74 a quarter, which is awesome.
So I actually brought
This one.
I actually brought my husband's over-the-counter card. Please note that I keep this in my wallet and I spend the money on his behalf. So if there's any of you shoppers out there like me, just keep that with you. And also don't forget that it gets loaded quarterly, January, April, July, and October. Spend the money.
Yep,
okay?
absolutely.
And now we get a raise on it.
We get a raise of $74. This is the plan that Laverna has her husband on.
My girlfriend, my best friend, my mother, my best friend's husband, and probably, I would guess I have close to a huge percentage of my clients are on this plan.
Yep, for sure. So there are some changes here to the plan, mostly for the better. You're going to see cardiac pulmonary rehab has gone down in price to $15. The inpatient hospital benefit has gone down to $320 per day, days 1 through 7. Days 7 and beyond, no extra cost. You'll see the increase in the over-the-counter benefit for all regions. Regions 1 and 2 up to $100, Regions 5 up to $95, and Region 3 and 4 up to $74. The other thing to note on this is it is not just an over-the-counter card now. It is also they call it over-the-counter plus on the Key Plan, where if you qualify, you can now use that card for food benefits as well. We'll get into that a little bit later in our conversation.
And just one more thing I just wanted to point out is that on the diagnostic imaging, the MRIs, CAT scans, PET scans, that kind of thing, those are in Region 5, we're 130, and now we're 160 like the rest of the state.
Right.
Okay?
Yep. So it's consistent through the state.
Yep.
Okay. And the next slide here.
The value plan. This is a plan that I'm not going to spend a lot of time on because we're trying to get people out of this plan.
Yep.
It can be a good value for some places, like maybe in the Grand Rapids area, but for the most part, I am encouraging people to look at the Key Plan over the value plan. Next slide. And here's the changes for the value plan. The over-the-counter went up from $25 to $40 a quarter. And then, of course, you see the changes on the emergency room there. So the Priority Medicare plan, this one has been around since the inception of the Advantage plans for Priority Health. So it's an older plan. I'm trying to get people to move out of that plan because I don't think it's worth it anymore when you can get a zero premium plan. Here's the changes for the Priority Medicare plan. Similar changes of what you've seen on the other slides. They did also raise the over-the-counter up to $40 a quarter.
Okay. All right, and so that is our HMO plans, and now we're going to switch over to the PPO plans. And the first PPO plan is another one that we're not going to spend much time on. But last year, this plan was called the Priority Kroger Plan. Kroger is no longer an in-network pharmacy with Priority Health. So this plan has been renamed to the Thrive Plan. It only affects people in Region 5. So we would probably recommend at this point, if you're on this plan, and you still want to know if it's a good fit, give us a call.
Yeah.
It may not be the best fit for you anymore. So we won't spend too much time on that plan, and we'll move to the Part B credit plan.
Okay, this one is called the Vital Plan. This is the one that gives the infamous give back benefit. We have a lot of questions during the annual election about what plan has the give back benefit. Well, I always tell people, always remember that when you get something back, you have to give something up, okay? So just always remember that. But the Vital Plan does have that available. It's $30 on that per month as far as the Part B give back benefit. It's available in Region 1, 2, and 5. So I don't think I have anyone on this benefit because I don't write a lot of business in those regions, and I don't necessarily recommend it when I can compare it to the other plans. So here's your changes to the Vital program. And as you can see, it's got some little minor changes like that. More on the over-the-counter benefit is always good. So
we'll move on to the Edge plan. This is another plan that we do like. It's available in regions 1, 2, and 5. I know, Laverna, you have several people on this plan.
Yep.
It's a goodie. If we look at the benefit page here, we're going to see some changes for the better for the most part, where the cardiac pulmonary rehab again has gone down to $15. The inpatient hospital, $320 per day, down from $350. Days 1 through 7, and then 7 and beyond, no cost. And you'll see a nice increase in the over-the-counter benefit up to $95 per quarter, which is great.
That I get jealous when I see that.
Right.
$5 a quarter.
Right.
Why don't they get some more money? Okay, now we're on to the Compass plan. Compass has been a very popular plan up here in northern Michigan. As you can see, it's available in regions 3 and 4. And some minor changes to that. If you can go on to the next slide. You've got the cardiac pulmonary rehab, again, has gone down in price, or gone down in cost. A little bit change on the inpatient, emergency room, and then of course they get $80 a quarter for it. So I'm again jealous on the $80.
Pretty nice.
So anyway, but that's a nice benefit.
Yeah, it's a great plan. On to the Medicare Ideal plan. Nice PPO plan that's available in all 5 regions. However, this one does come with a premium. So if you're on this plan, it may be a good time to look into the $0 premium plans. The plan has stayed exactly the same as last year, except for that increase in the ER pricing there.
The clients that I have on the Ideal plan are primarily ones that really like that PAPA or the companion care benefit, because it offers a really good, like 48 hours, I think it is.
Yeah.
Was that what it was? But for that.
Exactly.
And
so if you're somebody who needs companion care, this may be a good fit because it does have one of the most robust PAPA partnerships, and the PAPA is the companion care.
So that's kind of a maybe whether or not we think you should ever move from that plan, depending on how you use it. Yep. And also it's got a really nice over-the-counter benefit with it. So
Right.
Okay.
So these next few plans, we're calling them out. So listen up, make sure you check your card on what plan you're on. If you're on the Merit plan or the Select plan, these are the PPOs that we're calling out here. It's time for you to make an appointment and check in with us to just make sure it's still a good fit for you.
Just always remember that those plans are grandfathered. You can keep those plans, but I just don't see the value of you paying any premium to be on those plans. So give us a call.
The $0 plans have done so well. It's coming in with so many good benefits that we do the math, and the math doesn't work anymore.
Right.
So.
And I just like to teach people how to keep the money in their pocket versus giving it to the insurance company.
Yep, absolutely. And we feel the exact same way on the Select plan.
Yeah.
The Select plan is a pretty pricey plan. It is available in all 5 counties. We do have several of you who are still on this plan as well. So definitely worth your while to give us a call and make sure that this is still a good fit. So now we're going to switch over to what we call the DSNP plans. It stands for Dual Eligible Special Needs Plans. Again, we're not going to spend a ton of time on these plans because there's not the majority of you who are on it. But if you have questions whether you would qualify or if you're on one of these plans, certainly let us know. But Laverna is going to take us through some of the benefits of these DSNP plans.
The first DSNP plan that we're going to talk about is the one that's called the Priority Medicare DSNP Advantage Plan. It's available in Region 5. I don't think I've got any clients on this plan down there, but it does have some very robust coverage in terms of their eyewear and the preventive dental coverage and different things like that. You're going to see a lot more coverage in the dual eligible plans in that regard because they not only include the Medicare, but they also have the Medicaid in there. Okay, so go on to the next slide. Okay, so here on the next slide, you're going to see what this looks like. Always remember that these plans have the original Medicare plus the Medicaid, and so therefore all of your copays are going to be that zero liability.
Yeah,
okay,
that's nice.
The next one, this one is called the Priority Medicare Dual Eligible Program. This one is a statewide plan, and this is the one that I primarily use. Again, you're going to see the robust embedded extras and different things. And again, this is used by both the original Medicare, the Medicaid combined together with the zero liability. I just have a handful of clients that are in dual eligible plans. So if you ever have any questions on that, let me know because there's more and more people that I'm finding that because of the low income that can qualify for these plans.
Yep, for sure. So looking at the plan premiums here, we're going to see that all the plans saw a decrease with the exception of the Priority Medicare Select plan, which stayed the same. And as far as the Enhanced Dental and Vision buy-up package, we did see an increase across the board with those plans. And you can see those prices listed out there. Depending on which plan you're on, you'll see the increase there. And just continuing on now, outside of every plan, we have embedded extras. And when we say embedded extras, that means it's already included in the plan. So if you're on a $0 premium plan, this is all the benefits that are already packaged into your plan at no extra cost. So across the board with every single Priority Health plan, they offer the Abridge, which is an app. We'll get into that a little bit more. They offer the My Strength, the Brain HQ. Those are standard benefits across the board on all of the priority plans out there. Most plans other than the DSNP plans have an over-the-counter benefit. All the plans offer mom's meals. We're going to get into that more. Multi-plan, Assist America, so many benefits, and most of them are across the board, including silver sneakers, which again, we'll get into that as we continue this conversation, but that's just a nice at-a-glance chart for your reference.
So like Dawn said, embedded extras in the dental coverage means that it's just simply part of your plan. So when you think about embedded dental coverage, all of the plans include your cleanings, your x-rays, your oral exam, brush biopsies, panoramics every 2 years. Those are all part of the plan. However, in the Key, Vital, and Thrive plan, they add on extra coverage in there for 100% coverage on fillings, crown repairs, non-surgical extractions, and so on, like what you see there in the slide. So keep in mind that those are part of in the embedded part of this package, just like the cleanings and everything is in this package. So the other plans, you're going to see that the fillings and such are in the added benefit for the dental. So with the vision coverage and the embedded extras in that, you want to think about anything to do with your diseases of your eyes, like glaucoma, cataracts, macular degeneration, eyeglasses after cataract surgery. Those are all considered medically necessary. It's part of your package. However, on routine vision, This is powered by iMed, their iMed benefits. You get 100% coverage for a routine eye exam. You get retinal imaging in there. You get $100 towards eyewear. Again, some plans might have a little more than that. And then, of course, if you go to non-iMed providers for your routine vision coverage, we can ask for reimbursement on that.
And then the nice thing is, in addition to what's embedded into the plan, we have an optional buy-up. It's an optional enhanced. It enhances your dental and vision. So on the Key, Vital, and Thrive plan, that buy-up is $33 per month. Now that is going to cover now 50% of all of your crowns, bridge repair, the surgical extraction, implants, dentures are covered 50%. That started last year, and they've upped the annual benefit to $2,500 on all of those big items. On all of the other plans, it's a $0 copay now for fillings, crown repair, all of the things you see there on the screen. And for all of the other plans that are available, the buy-up is $42. Really nice option there. The other really nice thing about the dental and vision is when you're new into this optional enhanced, there's no waiting period, which is great. So if you're one of those people who's like, oh, my dentist says that there's a tooth we're watching, probably be a good idea to get on this enhanced dental and vision so you can get that coverage on your crown, root canal, any of that really fun stuff.
And don't forget to mention that they get that extra $150 of eyewear.
That's true. Yep. It not only enhances the dental, it enhances the vision.
Yep. So now you've got
$250 on your frames. Yep.
Okay, hearing coverage. This is done through True Hearing. What I just tell people to do is call the True Hearing phone number. It's on the back of your Priority Health card. And you just call there and they will set you up with an audiologist that participates with them. And I know there's lots of them in our area. And it covers your routine hearing exam. If you're on the DSNP and Vital plans, the hearing aids are covered at 100%. However, on the other plans, you've got a copay range of what you pay for the hearing aids, and it's based on a per hearing aid. It depends on what kind of hearing aids you pick up.
The manufacturer.
So the audiologist obviously would be able to tell you what those copays would be for you in the end. Okay. The next one here is the Priority Companion Care. You can see what the hours are per year based on each one of those options. Companion care is designed to help you with household chores, transportation, grocery shopping, and so on. Also, social care and navigation to help members navigate through plan benefits and such. That's all part of the packages that you can see here. Next slide.
When we talked about PAPA plans earlier, that's what this Priority Companion Care is. That's the PAPA program. And
then you've got some on the dual eligible plans. You have caregiver support. That's only on the dual eligible plans. Okay. Next slide is transportation. Some of the plans have transportation. That's on the one plan and the DSNP plans. So you can see what the transportation benefits are there.
Now we get to the fun stuff. The over-the-counter. I have my
your husband's OTC card that I told you earlier. I spend this.
The over-the-counter allowance. It is a great benefit, and I know those of you who are using it love it. You'll see the allowance there on the screen of what each plan offers. This is a quarterly amount. So if you don't use it within that quarter, you lose it. So make sure, get out there, utilize that benefit. Now you can order items from the catalog by the phone and online, and they will ship it to your door for free. Super easy to do. Also, you can go right into the stores, the Meijer, Walmart, CVS, Walgreens, those stores. You can go right in, and on the shelf, you'll see the items that are over-the-counter eligible items, right? So they've made it very visually easy for you to know which items to take off the shelf and what will work for your debit card that they send.
And when we say it's loaded quarterly, I want to make sure I stress that it's January, April, July, and October. That's when you get your quarterly amount, and then you've got till the end of the quarter to spend it. And what's exciting this year, and we've heard you say this, that you want Meyer in there. That's new for 2024. Keep in mind that it's not available yet for 2023. Okay?
Right. All right. Oh, and then the next nice thing here is a few of the plans have changed from not just an over-the-counter allowance, but it's called the OTC Plus allowance. So our One, Vital, Thrive, and now the Key plan is an OTC Plus program. So if you qualify, you have to meet all of the following criteria there that you see on your screen. But if you qualify by meeting those criteria, you can now use that over-the-counter card for groceries as well as boxed meals through the Mom's Meals benefit. So if you do qualify for that, that's just a nice added bonus. If you don't qualify for those criteria, you still get to use your over-the-counter card just like any of the other plans.
Our next benefit here is chiropractic coverage. Now, I like to explain chiropractic like this. There's kind of two different ways to look at your chiropractic. One is routine, okay? That routine chiropractic, you are limited to 12 visits per year. That means that I just like to routinely go into the chiropractor, okay? The other way that you look at chiropractic is that it's necessary. I have a reason why I should go to the chiropractor. So that's the two different levels of chiropractic. The necessary chiropractic doesn't have a limit on how many times you can go, but the routine does have a limit on the 12 visits per year, and the rest, everything is a $20 copay no matter which way you go on that, okay? Acupuncture, that's a nice extra benefit in there, $20 copay per session. You get to up to 20 Medicare covered sessions for your chronic low back pain and such. And then you get an additional 6 non-Medicare covered sessions for other conditions like your chronic pain, not low back, but chronic pain, anxiety, and sleep problems, headaches, chemo side effects. Those are all limited to 6 visits. A bridge. I want my husband to do this one.
I would love that too.
Yeah,
I haven't heard any feedback on this yet.
I want him to do this. This is where you can put an app on your smartphone and you can record your doctor conversations and store them, and then they can play them back when you come back home. You do want to tell your providers that what you're doing, because you shouldn't just record somebody just because. But anyway, it's just a great way to store your medical conversations.
It actually transcribes it for you, so you can send a transcription. Yep. Last year on our video, I called out like, man, I would love my dad to have this because my dad he comes home from the doctor's appointment and I say, how was your doctor's appointment? And he says, it was fine. I know that's not true with my dad. But some of you out there ratted me out and sent this video to my father, and I heard feedback from that. You know who you are. So
yeah. This is an awesome service for anyone that is a caregiver like that.
Perfect.
Okay, Silver Sneakers gym membership. That's been a part of the Medicare Advantage plans from the get-go. There's lots of Silver Sneakers participants out there. You can gym hop from gym to gym, whether it's in Michigan or out of Michigan. So when you're traveling, as long as it's a Silver Sneakers gym, you're good to go.
The next extra that they offer is what's called Brain HQ. This is another, they call it a gym for your brain. And research is showing that people who are using this Brain HQ are showing less depression and more happy days. They're showing improved focus, 48% fewer at-fault car crashes, 135% faster auditory processing, and better self-rated health. All right, the next extra that Priority Health offers is My Strength. It's embedded in all of Priority Health's Advantage plans. And this is an online mental wellness tool that helps things like manage depression, sleep, reducing stress, finding daily inspiration. Can even opt into having a one-on-one coach. So that's something, if you're struggling with any of those things, it might be something that you'd want to look into.
Mom's Meals. This is eligible to anyone following an inpatient discharge from the hospital or a skilled nursing facility. What happens behind the scenes is that the hospital, for example, will notify Mom's Meals and they'll connect with you, and then they'll send you the meals at zero cost to you. So take advantage of that. I know that they'll make those meals according to your dietary specifications. If you need gluten-free, low sodium, whatever your concerns are there. You can also purchase the meals directly from Mom's Meals if you choose to. And then remember that the members with the OTC Plus can use their OTC allowances to go towards the purchase of meals if they would like to. The next benefit is free to talk. This is kind of a nice little add-on. So many times we want to go into our annual physicals and ask extra questions. What this basically means to you is that your annual physical is truly a zero copay. So any of these extra things that you ask about within your annual physical, they can't charge you extra for it. So it makes your annual physical for all services truly zero cost. Okay.
Next, we'll jump into the Priority Health Travel Pass. And Laverna also brought her husband's Travel Pass card. So when you enroll into a Priority Health card, you not only get your insurance card, but they send you this handy dandy little Travel Pass card. It really doesn't give you any more. It's the same ID number as your normal insurance card. It's just really a visual aid that says when you get out of the state of Michigan, out of the mitten of Michigan, even up into the UP or any of the other states, and you seek a doctor or a provider or a facility that accepts Medicare, your plan is in network. Sometimes we hear that people go to a hospital in Florida and they say, we've never heard of Priority Health. You say, I have a Travel Pass card. My plan is good if you accept Medicare. And there's a customer service number on the back of the card that you can ask the billing department to call that will direct them through all of the out-of-state billing.
I tell my clients to think of this as a ticket. I mean, if you want to seek medical coverages outside the state of Michigan at other Medicare providers, use this card, show it to them like Dawn described, and have them connect with Priority Health. And I know Priority Health will pay those claims as in your network. So in addition to that, you've got your emergency and urgent care benefits. Another thing that I like about Priority Health too is in the worldwide area of your benefits for emergency and urgent care, it's unlimited. I know that other carriers don't do that. So I've worked in this business long enough to know that if you are in a worldwide situation with emergency, it can rack up a lot of dollars.
Yeah.
So.
And I see on this slide here that we have for you too, and it's something we neglected to talk about earlier when we were talking about the dental. Priority Health partners with Delta Dental. We see that being a much broader network as far as dentists who want to participate. Like I said at the very beginning, we see a lot of dentists not wanting to participate with the Blue Dental any longer. Delta Dental still seems to be the front runner of the participating dentists in our area. All right, next we will just do a few of the pharmacy highlights. Laverna, will you talk to us about the Inflation Reduction Act?
Yeah, that's basically something that affects insulins with people. Under Medicare, members will pay 20% up to $35 copay. It was just basically an act that made it so that the insulin costs and for other Part D costs, Part D meaning the prescription drug program of your Medicare, that they've had some reductions in the cost and limits to what you should have to pay for that.
Yep. And the only other thing on pharmacy that we want to mention, this doesn't affect too many of us here in the north, but Kroger is going to be an out-of-network pharmacy come January 1st. And now we'll just quickly jump into the Medigap plans. We do have a handful of you that are still on these Medigap plans. If you are, like we said earlier, you're paying a pretty high premium. The math may not be making much sense anymore. it's really worthwhile to come in, meet with us, discuss if this is still the best plan for you to be on. If you are on a plan F, that is a grandfathered plan, and those premium prices are outrageous. If you're on a plan F, Priority Health does offer for you to move to a plan G with no underwriting, so no health questions, which is a nice benefit to help lower your bill. So this brings us to the end of our presentation, and I said that we would answer some of those frequently asked questions one last time before we close.
So okay, Dawn.
All right, let's see if I learned anything here.
Do I have to do anything to continue my plan if I'm happy with it?
You do not need to do a darn thing. If you're happy with your plan, it will roll right into 2024. No signatures, nothing to mail in. You're golden.
If I'm on a plan with a premium, should I change it to $0 plan?
Well, I'll steal your answer from the beginning and say, maybe. Maybe you should. If you are paying a premium, the math may not make sense any longer, and it is definitely worth your time to come in and meet with us on that.
Absolutely. How do I add the extra dental and vision to my plan?
If you want to add the enhanced dental and vision, you can call the number on the back of your priority card. They will add that for you. You can contact us. We can send you a form or send you a link to add that.
Here's a question we missed. What if I don't want the dental and vision anymore?
Same answer. If you don't want the dental and vision anymore, you can contact Priority directly, or we can send you a form to submit.
What do I do if I want to change my plan?
Great question. Give us a call. Give us a call. We'll walk through the plan that fits best for you and your needs, and we can make that change for you. We could do that over the phone, in person, video calls, whatever works best for you.
Do I need to show my red, white, and blue Medicare card to the doctor?
If you are on a Medicare Advantage plan, which most of you are, you do not. You can put that red, white, and blue card right in a safe place, and the only card you will need to show when you go to the doctor is your Priority Health Insurance card.
And last but not least, do I get a dental and vision card?
You don't. Everything is loaded on this one card. You'll see on the back of the card, it lists the phone numbers for Delta Dental, iMed, True Hearing, Silver Sneakers. Everything is loaded right into this card. So it is a one-stop shop with this one card, and that will be all you need when you go to the doctor. And I think I answered that last question right along with everything there. So so everything is included. These plans are great plans. We've been so pleased with them, and we've heard so much feedback from you just on how pleased you are with them as well. But as always, we're here. I've got our email addresses, our direct phone numbers for Forward Insurance will ring right to our desks. If you have questions, please let us know. And
the only other thing I'd like to say is that this time of year, it gets extremely busy. So if we don't call you back immediately or answer that email sometimes works best for me sometimes because I can answer that in the middle of the night if I want to.
Great.
But anyway, but the bottom line is that we do get really busy, and we will call you back. We will email you back. Whatever, we want to give you the best service we can and take care of you as our clients. So we thank you for being our clients, and always feel free to connect with us if you have questions.
Absolutely. Thank you so much for the time.